Great. So I'm just going to lead us out here. We want to be respectful of people's times. We know this is a particularly busy time for our public health colleagues as well. So thank you for being here to join us today. Our goal really is to just have a quick conversation relative to how things are rolling out in the states relative to um, higher ed's connection to and collaboration with public health. So we're going to jump right in, hearing first from our public health officials. Again, thanks to them for being with us as part of this conversation. This is a very busy time for them, as everyone knows. For your benefit, public health colleagues, the participants, as you know, really represent public and independent post-secondary institutions across the region, many of whom I'm sure you work closely with from all 6 New England states. What we're going to do in terms of just sort of Zoom etiquette and facilitation today, we'll just have you all stay on mute until it's your time to speak. We'll begin by doing a quick round with our public health colleagues for them to say a few words. After that, I'll probably ask a quick question, and then we're going to really just turn it over to everyone to participate. That will be made, I think, easiest by you just simply raising your hand. If you can see there on the Zoom bar, if you click on the participant panel or elsewhere, you'll see a function to be able to raise your hand, and that will probably be the easiest way for us to navigate that. That would be true for our public health colleagues if you want to chime in and help respond to a specific comment as well. This group has been meeting over the past several weeks as we've been working to address the realities of COVID-19 around the region. So most of us know one another. As mentioned, I'll just do a quick, brief introduction. We regret that sort of short notice we lost both of our Connecticut representatives, so we may lean on our Connecticut higher ed colleagues to be spokespersons here. But we do have Lisa Letourneau from the Maine's Department of Health and Human Services, Lindsay Tucker from the Department of Public Health in Massachusetts, Tricia Tilley from the Division of Health Services in New Hampshire, Patricia Raymond from the Department of Health and the Center for Preventative Services in Rhode Island, and lastly, Mark Levine and Tracy Dolan, both from the Department of Health in Vermont. So to kick us off, what I'm just going to ask us to do, and maybe Lisa, if you wouldn't mind just kicking off, I'd like to just ask each of our public health colleagues to give just a quick 3-minute summary or so, sort of the status of reopening planning in your state, and then sort of your assessment of sort of the status of interactions and connections and communication with higher ed institutions and leaders specifically. So Lisa, would you mind leading us off? Yeah, we don't hear you yet.
Hi.
There you go. Perfect.
Hi. There we go. Sorry. So I said I'm not sure if there's more than one Lisa on the call, but I'm assuming you mean me. So
that's you. Go right
ahead. Okay. All right. So Lisa Letourneau, Senior Advisor in Commissioner Lambert's office here at Maine DHHS. So generally, in terms of reopening, Governor Janet Mills was probably on the earlier side of some of the New England states in announcing plans for reopening several weeks ago now, with a 4-phased plan for reopening that started actually May 1st, gradually reopening different types of businesses with issuance of guidance from the Department of Economic and Community Development for specific kinds of institutions. That actually just stepped forward even a bit further starting today, when she announced at the end of last week that as of today, certain rural communities would be allowed to move more quickly on that reopening in the 12 of Maine's 16 counties that have not yet been shown to have signs of community transmission. So those changes just went into place today with different kinds of businesses and organizations, still with a lot of caveats and expectations around social distancing and use of cloth masks, et cetera. In terms of, and these efforts are largely being rolled out by, again, the Department of Economic and Community Development. We have not yet taken on the issue of colleges and universities, although I know that there is a parallel group of the private colleges in Maine that's been meeting, and our community college system has also been eager to try to figure out their role. I don't know that you Oh, there's Becky. There we go. So Becky, with apologies that I have not responded to your email yet. I see Becky Smith on, and I can let her speak from the community college system if she wants to add anything to that.
Are you unmuted, Becky?
Can you hear me?
Yeah, go ahead.
Yes,
Now we
can you
can.
hear me now? Okay, great. No, and I see Chancellor Malloy from the university system is also on the call. So I'm Becky Smith. I'm Director of Government and Community Relations for the Maine Community College System. And we do have a group of the private colleges had a group meeting, and the university community colleges and Maine Maritime Academy have also been talking on a very regular basis amongst ourselves. And Chancellor Malloy has recently convened a group of presidents and top administrators from all of the colleges and universities in Maine to sort of make sure that we are coordinating our planning efforts to the extent possible. And we are looking forward to working with DHHS and making sure that anything that we plan to do meets all public health guidelines and expectations. That's basically where we are. We have many different scenarios playing out across our community colleges and within the system, planning for lots of different scenarios for the fall, and hoping obviously for the most on-campus participation as public health would dictate would be safe, but keeping our staff, faculty, and student safety as our priority. That's all I have to add.
Yeah, great. Thanks, Becky.
Yep.
No, sorry, go ahead.
No, there are a few other people on the call as well.
Yeah, no, I was going to ask
from
Dan
Maine.
Malloy if you wanted to add anything to that.
It was just stated, I was able to convene all of the college presidents and/or in a few cases representatives of the college and university presidents. So this is all public and private. Were invited, and we have a working group that will work on a statement and a series of subset statements on how we would go about opening our university community in the state. I think that probably can be wrapped up by June 1st, and hopefully will be signed off on by all presidents of all of the colleges and universities. Notwithstanding, obviously, our system, which is fairly large by Maine standards, with about 31,000 students, about 23,000 full-time equivalent, has been working on standing up its own committee structure on science, as well as individual science/medical, as well as other subgroups working on issues. And so a lot of that will go together. Hopefully, the entire community will speak with one voice. That's the design, to give guidance to the governor with respect to how to help a very large segment of Maine's economy, which is higher education, reopen in the fall.
Great, very helpful. We'll get back, and I think there's some more state-specific details and conversation. Let's maybe jump quickly to Lindsay Tucker. Lindsay's with the Department of Public Health in Massachusetts. Lindsay?
Sure, good afternoon. Thank you very much. So here in Massachusetts, we're in a slightly different position, I think, from many of you. We currently are under an executive and emergency order, stay-at-home advisory, and schools, as well as childcare, prohibited through the end of June. Just today, in a press conference, the governor and the lieutenant governor shared additional information about the next phase of what will be happening here in the Commonwealth with reopening. There's a target date of May 18th to look ahead for more information about what this phased approach will be. We are very much wanting to be data-driven and not date-driven. We do understand, of course, the necessity to think at the same time about the public health and safety impacts, as well as the economic impacts to all of this. So what was announced, or rather shared more fully today at the press conference, was a four-phased approach to reopening, and setting some expectations that what things will look like in the next phase after where we currently are is really limited reopening in terms of very severe restrictions on a small number of industries that could open further. And acknowledging that there will be broad guidance for industries, overall social guidance, mandatory safety standards for workplaces, and then also sector-specific safety protocols and best practices. And so outlining that and really looking, of course, at the categories of social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting that public health will support various industries and sectors in developing moving forward. There is a reopening advisory board and that is led by our lieutenant governor, and various sectors have and will continue to be presenting to that group, and higher education is certainly one of those critical sectors that is part of that list. So I will thank you very much for including me in this, and I will stop there.
Great, that's very helpful. Anyone else want to add anything to that? Otherwise, let's just maybe jump on quickly to New Hampshire. Tricia Tilley with the Division of Health Services. Tricia.
Hi, well, thank you so much for inviting me here today. And again, my name is Tricia Tilley. I'm from the New Hampshire Department of Health and Human Services, our Division of Public Health Services. And similar to the other states that you've heard, New Hampshire, in particular, public health has been working closely with our Governor Sununu's Economic Reopening Task Force. This is a bipartisan task force made of some legislators as well as members of the business community. Task force has focused on the mostly just business sectors and has been meeting for close to about 2 weeks now to craft that roadmap. That our first stop was on Stay at Home 2.0, which was starting actually today, May 11th, as well as May 18th. We've seen the opening of several sectors, business sectors, and they have been broad, from everything from allowing outdoor dining coming on May 18th. And then today on May 11th, we've had, again, a small soft opening of some retail sectors, outdoor activities like our state parks, certain healthcare services, dental services, and then some fun things like drive-in movies. We threw those in as well. Hair and barbers are probably the things that were the most controversial. In terms of the Department of Education, we have been working with our New Hampshire DOE on a number of issues related to the K-12 sector right now, as well as post-secondary. Most recently, we've begun to address some time-sensitive issues with our community colleges to figure out the best ways to bring students in who need to access labs in order to finish those certificate programs for this year. And we're anxious to work closely as we start thinking about what the fall has in store for all of us.
Great, very helpful. Thanks, Trish. Patricia Raymond, Rhode Island.
Yes, hi everyone. So I'm Pat Raymond from the Center for Preventive Services at the Department of Health in Rhode Island. And thank you for having me as well. Our governor too had announced a 4-phase plan to reopen, and we did reopen on May 9th. The first phase that we're in now, there's still many restrictions in place around social distancing, masking. Everyone who can work at home is asked to continue to work at home. Social gatherings are limited to 5 people. The second phase will loosen that up a little bit and probably move to 10 to 15, but these numbers change. I would say in Rhode Island, as far as we haven't set a hard date for when schools will open. We are asking colleges and universities to develop a plan based on guidance that we've issued to develop a COVID-19 control plan. that will outline how their school will implement the social distancing rules and the masking requirements, screening, cleaning, and all of those things. We have a education readiness team that consists of representatives from the governor's office, from the Department of Health, from the higher ed community, our Office of Postsecondary Commissioner. And there's a large stakeholder group, which includes all of the higher ed institutions. I mean, that's how we're going about it. And I believe we have a couple of schools opening in July, and some others are planning to open in August.
Okay. Great, thanks, Pat. Mark Levine and Tracy Dolan, I'll defer to you as to who would like to speak first, Vermont. And then after Mark and Tracy, we'll go to a quick Connecticut update. And Alice Pritchard, on behalf of the CSCU system, will just chime in first. So Mark and Tracy.
I'll defer to Dr. Levine.
Hi, Mark Levine, Commissioner in Vermont. So our Restart program is really started in the latter part of April and the beginning of this month, and basically involved a number of sectors, very small scale workforces of 2 and outdoor businesses, construction, manufacturing, retail. We've even tried to open farmers markets, but a very different farmer market than anybody in the call would remember, with a lot of restrictions, needless to say. Started to expand some of these operations in manufacturing construction to groups of 10, most recently. Tried to open up some sectors of the outdoor recreation arena. Are actively working on plans regarding childcare and summer day camp programs. Have done a lot in terms of recently trying to reopen sectors in the healthcare arena, specifically some outpatient visits and non-urgent outpatient procedures. For the non-college school years, everything has been pretty much stopped, with only long-distance learning in place throughout the remainder of this school year. Tracy and I are on calls on a weekly basis with a whole host of the colleges and universities in the state, none of which have had active plans for the summertime, and a number of which are beginning to make more definitive plans for the fall. But it's very, very early, and I can't say that we have as much in the way of a specific task force delineated just yet to really help with guidance on that, but that's pending. But clearly our largest university, University of Vermont, has already made announcements of plans. Others have been a little more in the planning phase and not yet announcing, but sounds like intentions are to begin to consider a fall semester. So we're kind of early in that arena. We've moved a lot faster in some of the business sectors and in the outdoors recreation and areas like that, all the while being very careful to keep things within Vermont and not yet expanding opportunities for people coming from out of state. I don't know if you have anything to add to that, Tracy.
Hi, sorry about that. No, I think that we have been feeling somewhat positive because of the low incidence in Vermont, recognizing that opening the borders will change things. So we're going to be keeping a close eye on our surveillance. But for example, over the weekend, we tested 727 people and had 0 cases. We also had 0 deaths. So we're in a good place, but we recognize that there will be a rise. And so wanting to work carefully with colleges and universities, one of the questions that's come up is the sense of their health systems and what they can absorb if someone became ill. So trying to talk about that, and what's the state role on testing and tracing versus the college role. We've been talking about that too. And with regard to PPE, there's been some nice collaboration that we've seen on the calls around PPE from some of the bigger systems attached to hospitals, for example. So those are the kinds of conversations we're having. Thank you.
Great, very, very helpful. And we'll try, I think, dive into some of those critical questions you just raised. Alice Pritchard and Jen Witness, maybe a quick snapshot from Connecticut.
Sure, this is Alice. I'll be happy to start, and then Jen can jump in. So Michael actually shared the Connecticut Higher Education Subcommittee reopen plan, so you all can see that. We don't need to read that to you, but it did lay out a number of gating conditions. The Department of Public Health and our public health experts have to help us make sure are in place, everything from, you know, the public health guidelines around face masks and social distancing to adequate testing, contact tracing, et cetera. So those things are laid out as the foundation from which we're all building our plans. Each of our schools is required, or in our case, systems are required to develop 4 plans, one on repopulation, one on monitoring, one on containment, and one on shutdown. And we're expecting the governor too also had 4 phases, must have been the magic number. But we do expect effective May 20th that some of our research programs can come online, again, observing all of those social distance requirements. And then we would slowly start to bring some programs on. We have some workforce programs at the community colleges and commuter colleges in particular that could participate in some programming this summer, as well as some other clinical and labs that did not get finished this spring that are holding up degree completion for students. And then additional programs in July and August, with September or 1st or August 24th, depending on what date we ultimately go with, opening up to the degree possible undergraduate residential programs. So there's a lot of planning going forward, and we've been working and are going to continue to work through our subcommittee with the independent colleges and the public colleges, working together to share ideas and come up with the plans that are required.
Thanks, Jen.
I'll just chime in that, you know, I think we're awaiting, like Alice, I think mentioned it, we're awaiting a little more specific guidance. So if you look at the last page of Connecticut's report, it's the Appendix 2. There's some bullets around what are the specific public health guidance for different elements of, you know, the university. And so I just would let folks know that we expect there to be more guidance to you know, really define some of this stuff, kind of like what, you know, the businesses, the DCD released very specific guidance for offices, for example, this over the weekend. So we expected to have something a little more robust coming out from the public health experts for higher ed. So this will be expanded upon. But 2 things I just want to note, because this has come up in my conversations with my counterparts in other states, is the issue of around 6 feet of separation, obviously being a primary you know, rule of thumb in classrooms. So not necessarily square footage density, but 6 feet of separation between, you know, students in the classroom. But on the rooms and the dorms, the big issue around that has been, you know, how many students per bathroom, and we're working on that right now. But they have not narrowed in on saying only singles or only doubles. But we're saying, I think, you know, we're gonna figure out how many students can share a bathroom, and that'll be the guidance that we go from, and we await to hear more on that this week. But that's really important to a lot of institutions right now.
Great, thanks, Jen, very helpful. Susan, I noted you had your hand up. Maybe just a quick step back to Vermont. Did you have a comment? Sorry. Susan Steitley, go ahead.
Yes, now can you hear me?
Go ahead.
To mention that this is Susan Steitley with the Association of Vermont Independent Colleges. I've been holding weekly conference calls with both public and private presidents And we have just developed a set of guidelines for allowing students to come to campus to pick up their personal belongings because so many were on spring break. So we're going to be submitting those guidelines to the governor this week. And we did work with Ted Brady, the Deputy Secretary of the Agency of Commerce and Community Development on those. And we are also starting to work on guidelines for restarting the colleges and having students back on campus. So we're just getting started on that process.
Great, very helpful. So thanks for the quick spin here. So let me just make two suggestions here. I want to pose a few questions to our public health colleagues here. One question might be, what would it help for you to hear from this group, post-secondary institutions here? And let me just also suggest that if you have, again, questions, you can text them. Maybe Darren, I'll have you I'm just going to see if I can mute a few people. Apologies. So hopefully you can hear me. Submit your questions via text. You can also raise your hand through the course of this conversation. Let me just encourage everyone to mute themselves otherwise. So let me just have our public health colleagues respond here. What do you think is going to be needed? Is your state going to come out with a requirement for a formal plan from each post-secondary institution? Do you expect that to be the case? And then also just generally, what do you think it's going to take to get students back on campus in the fall? In terms of sort of external requirements, in terms of overall public health, as well as, again, sort of plans or specific requirements, and specifically as it relates to testing and contact tracing and sort of the core functionality that's going to have to exist with institutions. So let me just turn it back to our public health colleagues to have you respond to those questions. You can just raise your hand or speak up.
This is Tracy Dolan in Vermont. I can tell you for healthcare, as they've moved toward reopening in Vermont, they were requested to develop, we asked them to develop a proposal and give it to us so that they could fashion what makes sense for them, and it was reviewed, and they are being asked to submit some plans. And my guess that would be that for colleges and university, it may be a similar case where it's a concurrent path, where there's some conditions being developed, possibly by a governor's task force, for example, or education, and at the same time, plans being developed so that those merge together. That would be my guess. We haven't gotten that far yet, I don't think, Dr. Levine, but we would certainly want to review anything coming in, and we'd like public health, significant public health input, so it's driven by public health. However, it would make a lot of sense that colleges and universities develop a plan.
Great, thank you. Other responses?
This is Pat from Rhode Island. I had mentioned that we did issue a guidance document for the colleges and universities to use in developing their plan. They would, at some point, they'll be, I believe it's by June, they'll be submitting their plans for review, and we would provide, the department would provide feedback on that and go from there.
Thank you. Tricia, Lindsay, Pat? Or excuse me, Tricia, Lindsay, or Lisa?
Hi, this is Tricia. I think similar to the other states, we haven't quite gotten there yet. Any plan, we would anticipate that there would be a planning process and public health would be engaged. But clearly, we're going to be looking to our partners in education to develop that plan. We don't know your business as well as you do. And then we want to be there standing side by side as you think about these really complex issues around how do you do the social distancing within all of the areas of your campus. I think that that's going to be the piece that is, the million-dollar question that we're all trying to solve.
Thanks, Lindsay.
Thank you. No, nothing to add. I agree with the way my colleagues have represented this. Obviously, we'll need to be in close partnership between public health and the higher education experts to ensure that when campus is open, that it can be done safely.
Great. And Lisa, it sounds like Maine is moving towards formal institution-specific plans. Is that accurate?
Well, not necessarily. I mean, I think the guidance has really been more general and really, again, looking at institutions to come up with their own plans, but it has been more in general around institutions' general guidance versus requirements. So I think still very much a work in progress. But.
Okay. Well, back to then the question for everyone then of what is it going to take to get higher ed students back on campus? Give us your perspective. And a couple of the questions that we've had come in have to do with requirements for density standards, particularly as it relates to on-campus housing and also testing. So give us your thoughts on that. What is it going to take to make this happen in fall?
This is Mark Levine of Vermont. Just one other public health consideration. At this point in time, we have the requirement for anybody coming from out of state to quarantine for 14 days. And we're trying to actually simplify that a little with some testing worked into it. But the bottom line is that consideration needs to be built into the entire context of what we're talking about here before classes would even begin for that particular student.
Okay.
Can I ask a follow-up on that? Dr. Levine?
Go ahead with the follow-up.
Yeah, so how would that work for those that were our students left and have their belongings they have to come back to get?
Yeah, so sort of like a one-day come back and pack up and leave?
Exactly, yeah. Yeah.
I shudder to think of how often we probably don't even know when that will happen. But we've talked about it, and we're thinking that, you know, as long as people were just coming to do that and then leave the state quickly, as long as they adhere to all the other social distancing and facial covering guidance, that's probably the best we could expect. The concern would be if they're coming with their whole family and they have to, you know, eat, they have to stay overnight somewhere or whatever, that obviously complicates life completely. So we're trying to have sort of that kind of guidance that would allow them to just enter and leave.
Okay, that's helpful. Other perspectives, what is it going to take? So the possibility of the 14-day standard quarantine still being in existence, is that true for other states, or what other views do you have in terms of what it'll take?
This is Pat from Rhode Island. Yes, so we do too have a 14-day quarantine in place, and it would depend on what phase we're in when the school opens. And where we're at with that, but any out-of-state students would be expected to quarantine for those 2 weeks as it stands now.
Okay, and would that be sort of like an on-campus quarantine, or would that be sort of like a resident-specific quarantine? Is there a sense as to how that would occur?
Well, we would be looking to the colleges and universities for how they would manage that.
Okay, helpful. Other perspectives? Massachusetts, Lindsay, any sense from Massachusetts, or Tricia from New Hampshire on those topics of quarantine?
This is Lindsay. I echo my colleagues. There's currently a 14-day quarantine for us here in Massachusetts as well, and I think we're still obviously many steps away from what public health indicators would need to be in place for campuses to reopen. So we'll be working hand in hand in developing that with higher education as things move forward.
Similar to New Hampshire.
Go ahead, Tricia.
Similar in New Hampshire, I think we're all following that same lead. We all have our 14-day quarantine. We all know by the proximity of our states, we know that people are going back and forth across the border already. We know that people work back and forth across the border. But we are steps away, a number of steps away to figuring out what that really looks like to reconstitute your full campus in the fall, and what that would mean for out-of-state and, quite frankly, international students as well.
Thank you. Any other thoughts from our public health colleagues then in terms of what it's going to take? So likelihood of continued quarantine measures. What about these questions around density and testing? Another question popped up here around testing. Obviously, you raised the issue earlier around sort of distinguishing between college and state roles and capacity relative to testing and tracing and all those things. What is your sense of that?
Density issues here in New Hampshire, and I don't know how my other public health colleagues have been working through this in your states, have been top of mind even in our business community as we're looking at our economic reopening. We've had a lot of folks come to us and say, what's the right number of people per square foot? And I don't think we have a satisfactory answer to that yet. We have been going with a standard, that it is optimal to have 10 or less people in any particular space. That doesn't really bode well, however, when you're talking about large areas, and what does that mean when you have equipment within those areas? And so we are continuing to slog through thinking about both the science and the math of how do you figure out what the right number is in a particular state and in a particular space. And again, this is a place where I feel like we have a very unsatisfactory response right now as we're figuring it out.
Helpful. Anyone else?
Well, this is Pat.
Go ahead, Pat.
I think we're struggling with the same challenge. We know that the business regulations, I'm sorry, the businesses just opened over the weekend, and they're supposed to, maintain 300 square, one person per 300 square feet. And we've been discussing what groups of, say, 10 would look like in a smaller space and how far apart those groups should be. Our faith-based guidance has said something about 10 to 12 feet. Yeah, and there's really no sort of science behind that. Just what makes the most sense for that particular population or setting.
Other responses. And on this issue of testing, how are public health leaders currently thinking about this? Obviously, big question nationally is availability of testing, and certainly we see this issue really rising as an issue of concern amongst our post-secondary leaders. What are you going to presume will be the testing need or requirement, and then two, how can it come to pass in the respective roles of institutions or states? Anyone want to jump in, Dr. Levine or Lindsay or Lisa?
Sure, this is Lindsay from Massachusetts. Obviously, testing has been a critical priority of the Baker-Polito administration, and ensuring that we are ramping up additional testing and testing capabilities in partnership with our research and private sector and hospital colleagues. We have also initiated a massive contact tracing program in partnership with Partners in Health, which is really a global not-for-profit that happens. We are very fortunate to be based here in Boston. And so testing and contact tracing obviously go hand in hand in needing to ensure that we have enough of a system that we are just ramping up and being thoughtful about what is needed as the phases move forward.
Thanks.
This is Pat in Rhode Island. Yeah, last week our governor had announced plans to work with the colleges and universities and other community settings to to set up these warning testing sites. So that's sort of in progress, thinking through that.
Great, helpful. Lisa, anything from Maine?
And this is Tricia from New Hampshire. You know, again, we have been fortunate that we have been able to do contact tracing from the very beginning with every positive case that we've had. We are ramping up our testing capacity just like all of our other colleagues across the state, and we're feeling very positive about that. But again, I think we're all struggling at this moment of what that would mean when we bring in new folks to campuses from out of state and from international, and what that process would look like. Because again, testing only tells you for the right now that you're not positive. So I think we're all thinking about what antibody testing means and the process for testing ongoing for the next year or two.
Okay, thanks, Trish. Lisa, did you have a comment? Sorry. Looks like we might not be able to hear you again, Lisa. Apologies. Well, feel free to speak up whenever you can get back on, Lisa. I know we don't have a mute control on here. I don't know if you're coming in via phone, but Dr. Levine, Tracy, anything from the Vermont perspective on these issues?
We, like the other states, are ramping up our testing capability, and we haven't actually isolated out colleges and universities in terms of the strategies or the planning. We are like the other state that just mentioned, that New Hampshire, I guess, that we have capacity right now to test, and we've been able to do the contact tracing we need to do. So we don't think that would change with the opening of schools. A couple of the schools that are on the weekly calls with us have made the suggestion, if you will, that they could engage in the contact tracing work as well. We actually haven't requested that they do that. It's more just an offer that they've made, feeling that they had the capability to do it as well. Right now, we feel like, you know, we have a workforce that's been trained specifically for that, and rather standardized. And so we'd want to probably keep it that way unless things, God forbid, got to an overwhelming point.
Okay, very helpful. I guess it might be a question between some of the larger New England states and some of the smaller New England states in terms of both availability of testing and tracing. That's interesting to hear. It sounds like Vermont is well situated, however, to move forward. So what else, the issue of international students has popped up here. I don't know if that has been given any thought from the standpoint of public health. Certainly some of those students are going to struggle with visas and perhaps other constraints of getting back to our students, to our campuses, but they obviously are important members of our community in a number of different dimensions. So any thought or response to thinking about that? Pat, were you trying to speak? Pat Raymond?
No, I wasn't.
Okay, sorry.
I couldn't hear you though. You were muted.
Okay. Yeah, any responses to that? What about international students?
Well,
what consideration in that regard? Go ahead.
I was just going to say that, I mean, I think just like out of state students, any students coming from anywhere outside of Rhode Island at least now, would be expected to stay to quarantine for those 14 days.
Okay. Other thoughts or considerations? Just same consideration as is given to other students returning?
You know, currently, I think we have nationwide travel restrictions in place. And most of the schools in Vermont that have international students have told me that the students that are still remaining on campus are comprised of a significant proportion of international students. So they've actually never left. And a smaller portion of U.S. students who just had no other place to go but to stay on campus. So unless something changes on the national front, I'm not sure the international question will be as significant or not, just because of the restrictions to come into the country alone.
Great point. Let me just ask our public health colleagues, what is it that you need to hear or know from post-secondary institutions to help further inform your planning? And I'm open to other questions that other of our colleagues on the call might have as well, either by raising hand or by chat. But what is it that you feel like you need to know to best understand post-secondary institutions? It sounds to me like there was, one of you had mentioned this notion of, a better understanding of institutions' own sort of health and healthcare capacity, perhaps is one thing. But what else is going to be helpful for you to know? Lisa, you want to respond from Maine if you're there, or Lindsay perhaps from Massachusetts? Lisa or Lindsay, or perhaps Trish and Pat or Dr. Levine, what else do you need to know from institutions?
This is Pat. We're working closely with the institutions through this stakeholder group. But I think as far as developing their plan, we too would want them to develop their plan around, their individual settings and their capacity. So I mean, we would be looking for feedback from them.
Okay, thanks. Trish, New Hampshire, or Dr. Levine or Tracy from Vermont?
This is Tricia from New Hampshire, and I think some of the silence that you're hearing is all of us trying to process in this moment what it is that we don't know. So we don't know what we don't know from our partners at higher ed. So I think right now that's what we're trying to understand, and where I think where you all will be putting your plans together for your individual universities with your really individual sort of constructs for each of them, whether you have a large whether you're a community college where you really don't have a large out-of-state presence, or whether you are a traditional liberal arts university with a large number of students that come in, what will that look like? And, as we've taken the baby steps, just even in economic reopening, we've known with every turn, there's a whole host of things that we didn't think about as we move forward, even as we're trying to understand sort of 4 major areas for allowing safety. And those 4 major areas really being about how do you do your health screening? How do you manage your social distancing? Are you thinking about face coverings in some way? And finally, what are your cleaning and disinfection policies? So, that's the big broad brush that we've asked businesses to consider, but certainly in a residential environment, there's so much more.
Okay, great. Other thoughts, Dr. Levine, Tracy? Well, let me just
introduces the entire concept. Oh, sorry.
Go right ahead.
No, I mean, it just introduces the entire concept of individuals in congregate settings, whether they're learning in the congregate setting, whether they're living in the congregate setting, and every one of our states that's trying to reopen and restart things is going in the opposite direction from where we all started, and starting with the very smallest number of groups together and working our way cautiously forward from there. And so obviously all the schools understand that school will not be what it used to be, at least for the near term. So whether we're talking about lecture courses being more remote, whether we're talking about having smaller discussion and seminar courses now occupy the rooms that lecture courses used to occupy so that proper social distancing can occur, and whether we're talking about single rooms and dormitories versus double rooms, what kind of bathroom access, what number of people have, what kind of cleaning protocols. I mean, the issues are just abundant, and we've raised some of them on the calls, and everyone's being very, very thoughtful about them, but and can use some guidance from the Centers for Disease Control to some degree, but by and large, everyone is sort of making up the playbook as we go along, and we have to be cognizant of that and realize that we're just trying to put all the issues on the table and see if we can intelligently address them and still have a worthwhile experience come out of it all when it comes to learning.
Great, thank you. Anything else, Tracy or Lindsay? Well, let me just open things up to my colleagues here. We've got a group of people who are obviously engaged in this in their systems and their institutions. What are their questions or comments or perspectives from our higher ed leaders here on the call? What are you learning in the process? What questions do you have? What issues do you sort of foresee or are you wrestling with right now? Give us your perspective from sort of the on-the-ground experience in your states as you're trying to sort through this. You can raise your hand if you'd like. I can call on you if you'd like to say something. Go ahead, Kathy.
Thank you all for your time and all the work everyone's doing, certainly across the institutions and across the states. My name is Kathy Collins. I serve as the Vice President for Student Affairs at the University of Rhode Island, and I'm currently sitting on the Governor's Task Force in terms of reopening higher education across the state of Rhode Island, and that's been very valuable. As we continue to meet, one of the things we do struggle with, and I'm the one who certainly posted a question I know we all have about testing. I think we keep hearing about the importance of testing and how we're going to test, and we are looking at that in regards to, do we get the Abbott machine? Do we look at different types of machines? How many can we test? And just this morning, for example, and I have a very robust health service operation on campus, we were looking at how many Abbott machines would we need to run 4 tests per hour. And we believe with our campus population of 18,000 students alone, it could take us up to 200 days to test. So as we think about when would we test, frequency of testing, you immediately have to start thinking about supply chain, supplies, PPE. So I think we're really wrestling with how do we open in terms of testing, recognizing the importance of testing, also contact tracing. And finally, I was very happy to hear some of you share, and we just recently formed a new committee on campus focused on the student experience. How are we going to be assisting our students to transition back to campus? In addition to, how are we going to assist them in terms of the overall student experience? Is it a compact they need to sign about face coverings? Is it, how do we recognize social distancing? So I'd love to hear from any of our colleagues in public health or others. How are you wrestling in regards to setting expectations for your students, let alone your faculty and staff and ourselves, about just how different higher education is going to be? And it's going to include face coverings, contact tracing, testing. How are we having those conversations, and how are you engaging students in those conversations? Thank you.
Great comment. Thanks, Kathy. Any response or reflection on that? Go ahead, Todd.
I think we're facing some of the same questions. One of the things that's pretty apparent through this conversation is, nobody has this really figured out yet. But, as we're looking at the announcement we just made about our intent to reopen, and that's our plan and our intent, we're going to have to reassess along the way and see if things suddenly get worse and we can't reopen. That's a possibility, but we're doing everything we can to plan for it. And part of it was looking at that testing issue. I think initially the thought was maybe we can test every single student and do that, before they, before classes start. But as Kathy noted, just the hours to go through a population of about 30,000 students is just not seeming very feasible. So we're looking at different alternatives. One of those is, to what extent can people be tested before they leave their home and show up on campus? Clearly that doesn't work if they don't self-quarantine in between the testing and showing up on campus, but it could help at least identify those that have antibodies and other groups that we could screen out. And I think the other point is the socialization issue. It's kind of a larger public health issue in terms of how do we educate, create a campaign. It's almost like a savvy public awareness campaign we have to do for our students, just to educate them around, why it's going to be important, and instill some peer pressure around the face covering, the social distancing, and behaviors that are different than what they're accustomed to, and different than what they perceive is going to happen when they show up on a college campus. So I think there's a myriad of issues. I don't know to what extent anybody is further along than anybody else, but I think it will be important potentially to share some of what gets developed and figured out along the way. I hear a lot of task forces. We have one in New Hampshire that's now formed for higher education. It's going to be run through the DOE, but it includes the university system, the community college system, and private colleges in the formation of base guidelines. And I think we can develop a set of base guidelines, but it's going to have to be unique to every campus, because they're in different locations, they have different situations. And this is the last issue I think I'll just raise that we're wrestling with, that we need to assure the safety for our students, for our faculty, our staff. But one of the groups that is also going to be a challenge is the communities where our colleges are located. So we're bringing in thousands of students from out of state, from different areas. New Hampshire is not a hotspot, but many of our students will be coming from areas that are considered to be more hotspots. And so one of the benefits of testing every student would be to give some assurance to the communities that they were in. But if that's not a feasible process that can be put in place, then really thinking through how else to give some assurances. And I think we can screen every student in terms of identifying those that are at higher risk than others. We can test those that screen to be at higher risk. But I think we're still seeking to find what are those best practices going to be that we can adopt. And I think it's one of those areas for higher ed where there is no competitive disadvantage by sharing that kind of information. So to whatever extent, I think any of us thinks we have identified some ways to address these issues. I think this forum, Michael, and what we might do maybe a little further down the road when more answers are developed could be really useful.
It's a great point, Todd, and certainly we can commit NEVI to trying to be a hub and a sort of a sharing and collection point for those resources. And if there's a way that we could help be the bridge for institutions to work together on those, that'd be great. Thanks for those thoughts and comments. Other thoughts, questions, or comments from our participants? Other observations or views or key points to be made here? Kathy, you had kindly shared around a mention of the I believe, American College Health Association, where they've got some very specific guidelines. We're happy to share those around with people. We found those to be useful as well, and we'll share those around with people. Other thoughts or observations? Other questions? Any other takeaways from those of you who are on the ground in the process of planning these activities? Connecticut's obviously got at least a sort of draft proposal out to the governor. Chancellor Merloe, I know you've got a working group there. What else is sort of bubbling up here as sort of key considerations that we haven't hit on yet? Other issues or concerns, needs?
It appears to me, just listening, that obviously every college and university is going to have its own plan, and there probably need to be a convener in every state for kind of the larger standard, and then each campus within a system within the state, private or public, is going to have a plan, a public document to its students, its faculty, and the broader community in which the campus is located. So it seems to me that's a beginning point. It's not an end point by any stretch of imagination, and that we are really in the early throes of this. It's just in the last few weeks that states have taken real steps towards opening. There's been a lot of conversation of taking steps of opening, but only recently actual steps being taken in earnest, and not a whole lot of that in the more highly affected states like Massachusetts and Connecticut. So I mean, I think there is a reality that we've got to be ready for state type standards. We've got to be ready for every campus to have its own plan of how to incorporate those, or all these other issues around NCAA sports, around authorized intramural sports that are going to occupy, I think, the rest of our summer as we try to decide what is and what is not acceptable. The whole idea of the 14-day quarantine is going to be a real dilemma if that continues to be the requirement when August 28th in our state comes around. And I'm not sure how to get through that particular issue. Do we bring people back on August 15th and put them in a room that doesn't have particularly good ventilation, air conditioning, or food? So I think that or do we just simply say that every student has to go to college in the place that they're currently located in? These are very real questions that I think are going to have to be asked. An importer like Massachusetts, given the volume of students that come from out of state, that's going to be a very real issue that I just don't think we know enough about today. So miles to go before we sleep.
Yeah. Great points. Any other observations or comments?
This is Alice Pritchard.
Go ahead, Alice.
I hate to follow the former governor, but I will. I just want to say that one of the things we are doing at CSCU as part of our process is allowing for a campus-based discussion to start, and then ultimately we'll have to have system-level conversations. But it has made faculty and staff, and to the degree students are involved, feel a little bit better about the fact that they have a voice in this process. I think there's a great deal of anxiety around returning to school too early. And so it's given them an opportunity to provide some input. We have also engaged our labor unions in those conversations so that they're in at the very beginning, and hopefully we can all kind of move along in this process. But I would agree with the chancellor that the individual campus plans are important, if nothing else, to give them a sense that they have voiced their own unique characteristics and their own unique needs, even as we move to potentially more of a system response.
Great, very helpful.
So,
Yeah, go ahead.
So I hate to speak after Alice, but it's good to be with her on any occasion. The those discussions began on the day that on each of our campuses that we sent everybody home. The reality is those conversations were going to take place. We have given them a forum now on all of our campuses and have stood up a number of committees that are hearing people out on that very subject. And, you know, we're going to probably have to have different standards based on the age of a faculty member, giving them the right to exercise certain options that perhaps not everyone is exercised. There's all kinds of those issues that have to be worked out. And I'm in total agreement with you, Alice.
Great points, critical process considerations. Other thoughts, input, other sort of views and perspectives for people who are on the ground and doing this real time with your institutions. Go ahead, John.
Yeah, it's good to see everyone. John Vaughn, University of Connecticut, Vice Provost for Academic Affairs. Everything that we talked about today is being talked about across the U.S., as you know. I'm on an APLU transformation cluster with 9 other universities. We had this very similar conversation on Friday. So we're kind of all in this together. What's interesting to me is some of the states seem to be treating things a little bit differently. I know in Connecticut, we have a bunch of gating conditions that we are going to need to address. And so right now we have to get plans in for repopulating, monitoring, containment, shutdown, all this to the state. But it is a partnership. And like Governor Malloy was saying, it's continually changing, right, day to day. And so the key is trying to keep everyone engaged and not feel that kind of, we're starting to sense this sense of weariness coupled with that anxiety. And so part of that is that communication is really key.
Great points. Yeah, and let me just put a question out to our higher ed colleagues here. We still have a number of our public health colleagues here. What questions do you have in terms of what it is you feel like you need to know? What are critical information you needs that you have that they might be able to be helpful with? Are there further connections or contacts or resources or things that you would like to be able to draw upon? What would your asks be? If you could ask 1 or 2 things from our public health colleagues, what would they be? Yeah, go ahead, Alice.
I think contact tracing, and somebody mentioned it, I'm not sure if it was Maine or another state, but trying to figure out how we might do contact tracing at the campus level. The public health system is going to be overwhelmed doing that for everybody else. And if it's for us, it's a gating condition. I think it might be helpful for us to know what kinds of strategies other states might be looking at in terms of engaging campus personnel in that role. Great point. Go ahead, Dan.
We're taking a serious look at, quite frankly, making that a opportunity, an educative opportunity for students in certain fields, as well as employment for students. We have about 2,500 work-study students. We always have about 2,500 state-paid students, jobs. So that's a potential workforce of 5,000 students. Many of those people in majors that clinical experiences are required. So we're taking a very serious look at that. To date, Maine has not stood up a statewide tracing operation. I think it's coming, but it has not been set up. So we're at it by ourselves a little bit, at least on a preparatory side of the equation.
Great perspective. Yeah, go ahead, John.
Yeah, so we're doing something similar, but we also have a new public health course that's being taught this summer, contact tracing of COVID-19. And the idea, it's a 1-credit, 6-week course to hopefully change. We're focusing right now on graduate students and see if we can't get essentially an army of folks that can learn how to do contact tracing. That's where we're starting. And like Chancellor Malloy was saying, we're also looking for some of our clinical students to be able to get some experience that way. And so I think that will be something that will be really necessary given the size of our campuses. It's all contingent upon, adequate testing ability though, right? So the state is committing to 300,000 tests, for all the public in the state. So that will be an important consideration.
Absolutely. Great, good point. Other thoughts, observations from our higher ed colleagues? What else would you like our public health people to know? Go ahead, Kathy.
I think one of the things that we're really paying attention to is not only the contact tracing, not only the testing, not only the social distancing and the face coverings and things that we need to do, but we're going to need assistance from our states in regard to liability. And that's going to be different from state to state. I'm seeing a lot of strong nonverbals out there from some of my colleagues, but this is going to be almost a prerequisite for us to think about reopening. We want to reopen. This is what we do. This spring has been hard on all of us. It's been hard on our students. It's been hard on our family members, our faculty and staff. But without some type of looking at sovereign immunity, liability insurance, we're going to have something so that the campuses are not held liable in regards to when a student becomes sick, when a faculty or staff member becomes sick, because we have to prepare ourselves. It's going to happen.
Really great point. A lot of head nodding as you saw. I know that's a specific element of the Connecticut proposal through executive order in Connecticut. My understanding is it's certainly the liability issue generally and a potential forthcoming federal stimulus bill is likely to be contemplated, though I don't know the precise status of it, but I think it's a critical point. And I guess Governor Malloy, your sense on the legal viability, is that something that states are going to be able to do via executive order, or do you think that's going to require legislative action? Or
I would strongly question whether you can do liability waivers by executive order, quite frankly. It seems to fly in the face of how that law evolved in those liability laws evolved, both statutorily and by common law. It just doesn't make a lot of sense to me. We have a law school. I'm sure some of the other university systems have law schools. I don't think you would poll the faculty and get anywhere near a unanimous agreement that would have any effect at all, quite frankly.
Yeah.
So I think that you can pass laws, but I don't think you can make declarations that affect the laws as they've been adopted and common law as it's been developed.
Yep, great, very helpful perspective. That will certainly be an issue. Any other observations from our post-secondary colleagues? We still have a few of our public health colleagues here. I see Lindsay and Lisa and Pat and Tricia and Dr. Levine. Any final takeaways from you? I'm sort of hearing certainly a fair amount of anxiety around this testing issue. So any thoughts or guidance you have around that in terms of either working with the state or with industry, but any other final points or observations from our public health colleagues?
This is Lisa Letourneau. I just say on behalf of Maine DHHS, thank you so much for all your careful thinking about it. It's clearly a work in progress. Going to take continued efforts. We're not going to have perfect answers, by the fall, certainly. So we just so much appreciate all your thinking and work on this.
Thanks, Lisa. Likewise. Any other final observations from our public health colleagues? Pat, Trish, Dr. Levine?
Hi, this is Tricia from New Hampshire. I just also want to thank everyone and recognize the incredibly anxiety-provoking work that this is and the number of unknowns that we're all walking through at this moment. I think all of us are used to being experts in our field and being able to rapidly come up with plans that we feel confident that we can move forward on. And this is such an unprecedented time where we're all learning as we go right now. So we appreciate all of the brain power it takes to get to the next step.
And my only final comment, in addition to thanking everyone, is the power of having company. These calls that we host each week, we don't always come to a startling conclusion or decision, but we definitely address problems. We find problems we hadn't even thought of that we need to address at subsequent meetings. And it's very collegial, and having everybody in it together, I think, really helps the problem-solving process. So I'd encourage other states, if they're not doing it in a collaborative fashion, even though every school is different, I understand, but if they're not sort of taking these high-level issues and being able to discuss them across their state in a collegial fashion, not just within an institution, I think that's very useful and could be productive.
Great, thank you. Pat or Lindsay?
Thank you so much. This is Lindsay for including us on the call. Really appreciate the opportunity to hear from my colleagues across different states in public health as well as higher ed. I agree this is an incredibly challenging time for all of us and will continue to be so for many months to come, and appreciate the opportunity to get together and be solutions focused. Thank you very much.
Thank you. Pat?
I want to thank everyone as well. It's a very difficult situation. You know, I don't really have anything to add. I would just echo what everyone else just said. It's really a work in progress.
Great, well, much appreciated. Well, I want to thank everybody who's participated, and thanks for your patience. This would be, I'm sure, a somewhat different conversation if we were all sort of sitting around a table or together in one place. So thanks for your patience with the awkwardness of the means. We appreciate the input of everyone who's participated, particularly our public health colleagues. Thank you for your thoughts and your input. Thanks to all of our higher ed participants as well. I've had the suggestion here that we might convene another one of these conversations around public health a few weeks down the road. To our colleagues who have been part of our somewhat regular New England gatherings of system heads and state commissioners and independent college and university representatives, I think if you're open to it, we might propose getting back on our sort of weekly or bi-weekly rotation on this, just going back to our sort of face-to-face conversations about how our reopening plans are unfolding. So sort of continuing this conversation in perhaps a slightly smaller group and with a little bit either tailored focus on specific areas of reopening or the broad issues. And again, perhaps coming back at some future point around the public health issues. Clearly, still a lot of questions to be answered here. But with that, let me just say thanks to everybody. We're really appreciative of your time, of your input. We've got some good notes here that we'll use in our follow-up. We appreciate the questions that have been asked. Certainly NEBI stands as a resource if we can do anything to help sort of increase the efficiency of all of the demands that are on people. You've made some great suggestions here around our socialization of students and sort of our public outreach. We'll give some further thought to that. If there are other ways that you can think of that NEBI can step forward to provide or bring together some people to collaborate on some shared solutions to this, please don't hesitate to let us know. Any final question, point, or observation? All right, well, we're appreciative of everyone. Thanks, stay healthy, be safe. Thanks again to our public health colleagues for your leadership and service, and we'll look forward to being back in touch with everyone. Thanks and be well.